Following remarks, we'll have some time for questions from the media. And a quick housekeeping item for reporters watching on the stream, we have a conference bridge open for your questions following remarks. And with that, I will toss things off to Nancy.
Good afternoon, everyone. Thanks for being here. Appreciate that. I'm going to just begin my remarks now, and as Hannah said, afterwards, if you do have questions, I will have some time for questions and responses. As you probably heard from the governor just a few hours ago, there are still fewer than 100 patients who have tested positive for COVID-19. And the good news is, in our region, we've had all negative tests, so no one has tested positive in our region. The good news is no one's tested positive. The hard work that we're doing is to make sure that if someone does test positive, that we're here to care for them. And importantly, that we're protecting our patients, our staff, and our community. Literally thousands of Carilion Clinic employees across the region have been and continue to be engaged in preparations for this virus before it appears in our area. In some ways, I would say life at Carilion just isn't the same as it was a week ago or maybe even a day ago. In other ways, we're doing exactly what we always do. That's to fulfill our mission of caring for those we're so humbled to serve, and in particular, caring for the patients that are in our hospitals and our physician offices. So what have we been doing? We established an incident management team a few weeks ago, and we're implementing several ways to facilitate the concept of containment, consistent with recommendations from the CDC and from WHO, as well as our own infectious disease experts. You will hear more about that in a moment from Dr. Skolnick, our chair of medicine. Our incident management team is available 24/7, and our command center is open 24/7. From an operational perspective, we have restricted hospital access by closing entrances and restricting visitors to one per patient. We no longer allow children who are 18 and under in the hospital, and certainly no one with flu-like symptoms is allowed in the hospital. All visitors are being screened. We have limited outside guests who are not hospital visitors. For our employees, we halted work-related travel and restricted non-essential travel between and among Carilion facilities. We are avoiding in-person meetings, and some employees are working remotely. For clinical staff, we've outlined procedures to ensure their safety, such as lots of instruction and communication on the use of personal protective equipment, information about the virus, and so on. These guidelines continue to evolve. We have identified specific areas at Roanoke Memorial Hospital where suspected COVID-19 patients can be isolated from the rest of the patient population. J.G. Hopkins, working with our staff in the emergency department, created additional areas of negative pressure regions in just 72 hours, allowing us to more effectively perform testing for patients who meet the criteria. As announced earlier this week, as of today, we are postponing non-essential procedures and surgeries, those that can be reasonably delayed in 6 to 8 weeks, and that is being done on a case-by-case basis. Also effective today, we have closed all our Carilion wellness sites until further notice. Now, within the coming days, we plan to further restrict visitors to our facilities and screen approved visitors and outpatients with scheduled appointments. We also plan to open a dedicated site here in Roanoke for patients who should be tested. The goal is to provide a resource for our physicians to refer patients for those who meet the criteria for COVID-19 testing. we are piloting telemedicine appointments at several practice sites. And while this isn't quite broadly available yet, it's something we're working very hard to make available broadly. As we look down the road, we are also working to increase capacity of ICU beds in our region. We're developing plans to reapportion bed space at Roanoke Community Hospital and to convert beds at Roanoke Memorial to ICU levels of care. In other words, we have been very busy and we're not slowing down yet. Needless to say, we are constantly evaluating this unprecedented situation and taking every step to ensure our patients, our staff, and our communities are safe. Now, let me turn this over now to Dr. Patrice Weiss, our Chief Medical Officer, to brief you on what we've seen so far.
Thank you, Nancy, and good afternoon. As you know, as of this afternoon, according to the Virginia Department of Health, we do not have a positive or presumptive positive case of COVID-19 in our region. There have been many rumors over the past few weeks about positive COVID-19 patients in our region. Carilion has so far tested 165 patients for the virus. All results that have come back thus far have been negative. However, we do anticipate and are certainly prepared to see COVID-19 patients. It may help me to clarify what happens when we test and what is likely the source of many rumors. Our protocol requires that employees who have been exposed or suspect they have been exposed to COVID-19 be placed on administrative leave and self-isolate if they didn't have proper personal protective equipment, or PPE, on at the time that they encountered the patients. Out of an abundance of caution, approximately 100 Carilion employees have been quarantined over the past few weeks because of concerns of potential exposure. Test results can take up to 3 to 5 days, and once we have a negative test, those employees are able to return to work. Now, let me assure you we are following the CDC and Health Department guidelines as follows. Social distancing, the term that applies to certain actions that are taken by public health officials to stop or slow down the spread of a highly contagious disease. In the case of COVID-19, this distance is 6 feet. We're limiting group sizes to 10 or less people, as you can see in this room right now. Wash your hands with soap and water. Wash your hands with soap and water, and wash your hands with soap and water. Cover your mouth when you cough or sneeze, and stay home from work if you're feeling sick. I want to emphasize that the health and safety of our patients, visitors, and staff is our top priority, and we need to take every measure to keep that focus. At this point, I'd like to introduce Dr. Paul Skolnick. Dr. Skolnick is our chair of the Department of Medicine and also an infectious disease specialist, so is certainly qualified to update us on more.
Thank you, Dr. Weiss. The situation, as you've heard, is fast-moving across the country, in fact, across the world, and our response has been rapid as well. All levels of this organization have been engaged in making sure that we're able to care for our patients and our staff in an appropriate fashion. The concepts we use in epidemiology in terms of pandemics are a phase of containment and a phase of mitigation. We're clearly, in this area of Virginia, in the phase of containment. And that's our chance to do our best to make sure that we limit the spread of the virus throughout this area. You heard from Dr. Weiss the ways that we can achieve that, and also from Ms. Agee. So all these concepts of social distancing, not coming to work if you're feeling ill, washing your hands with soap and water often are very important. And those are the kinds of endeavors that will help us to limit the spread of this virus throughout the community. Limiting non-essential travel, not taking that personal vacation you've been planning on taking previously, and limiting your engagement otherwise are really crucial. You've also heard a lot about our ability to test patients. We still have a limitation on the number of test kits that are available to us. So we're very careful and judicious about who we choose to test. Right now, we're offering testing to those patients who have symptoms that are compatible with the possibility of COVID-19. Those symptoms include especially fever and cough. I should mention that we're still at the tail end of the influenza season, and so most patients who come to us now with fever and cough will have influenza or some other respiratory illness. So our testing procedures make sure that we screen for those illnesses first and foremost, and if appropriate, then move on to COVID-19 testing. That's one important issue. You heard that we've limited non-essential surgery and procedures now. The reasons for that are multifold. One is to protect our supply of personal protective equipment, or PPE. That too is in limited supply, and we have to make sure that our physicians and staff have that available to use when it's appropriate. There are other reasons in terms of limiting the spread of the virus through the area, and our own staffing, both physicians, nurses, and other employees, to make sure we have the workforce to care for any patients who come to us with either the possibility of COVID-19 or actually with COVID-19 disease. So as practical information for people in the community, if you think that you're sick, stay home, first of all, from work, and then contact your physician on the telephone. We'll be able to speak through with you, through nursing staff and others, what the best decision is for you about where and when to seek care. That's an important first step. We're trying to limit the flow of patients to our urgent care and emergency departments so that we can take care of the patients in the best possible way. So call ahead, and we will advise you as to where you can best seek care. I want to assure you that we're working hard to make sure that we can maintain the staffing and the workforce here to do just that, to take care of patients as we need to, and many people are hard at work to ensure that we have the adequate staffing to do that. We're also trying to communicate as best we can to not only our staff and employees, but to the community at large so that everyone has the most up-to-date information. I should tell you that as an organization, and in terms of our incident command team and other things that we've stood up recently, we are in constant communication with our colleagues across the Commonwealth of Virginia, other hospitals, and other healthcare entities. We're in contact and discussion with the CDC, the Virginia Department of Health, and also importantly, our infectious disease colleagues across the country who are now functioning in hotspots such as Seattle, Boston, New York, so that we can understand and learn from them what they've done in terms of being prepared to handle this virus. And we can have all those things and more in place here at Carilion Clinic. This is tough for our community, and it's tough for our employees and staff, but now is the time to do the right things. Now is the time to limit your contact so we can contain the virus and hopefully at least delay our transit into the mitigation phase that places like Boston, Seattle, and New York are in at the moment. So I hope that you can help us get that information out to the community and help us support caring for the patients in this region. Thank you.
Thank you, Dr. Skolnick, who's been working 24/7, I think. We really appreciate what you're doing. Likewise, Dr. Weiss. We're so fortunate here to have such talented, incredible staff and physicians working side by side as we tackle this. But I want to say thank you to you all, to the media, because I can only imagine what it's like in this sort of unprecedented situation to be reporting the news. So thank you all for what you're doing all the time, and thank you for being here today. And secondly, I want to thank our physicians, our nurses, our clinicians, our technologists, our staff, and in particular our environmental services staff, who are working every day to make sure that we have a safe environment for our patients, for the community, and for our employees. The spread of COVID-19 is certainly worrisome, and we are doing all we can to be proactive in addressing the spread of the coronavirus. We are taking every step to assure that our patients, our staff, and the communities we serve are safe. The constant for us is our mission to improve the health of those we serve. The constant for us is to care for the hundreds of patients in the hospital who are sick, for the thousands, many thousands of patients who are in our ambulatory sites who have nothing to do with the coronavirus. We want you to help us get the word out. We're not kidding about this. Wash your hands. It's such a simple thing. Soap and water, nothing, you don't have to worry about anything else. Wash your hands. Take a moment and sing happy birthday to yourself. It gives you a little boost. Avoid close contact. You can see we've set this up so that we have the proverbial social distancing. And if you're sick, stay home. And just one more thing. In times like this, we all seem to get a little anxious, and our anxiety feeds on each other. Take a break. Use technology to contact your loved ones while remaining physically distanced. Try to get accurate information. Even so, take a break from social media. Be careful what you're watching. Take a walk. Take care of yourself. That's the most important thing you can do right now. And know that we are here. We're not going anywhere. And we are constantly evaluating the situation, and we will communicate to you promptly as developments arise. Thank you all.
Thanks, everyone. And with that, we'll open it up first in this room for questions. And if you guys could wait for the mic, as we have folks watching online. For our three speakers, if you guys could come up front, and depending on the question, you can take turns at the mic.
Hi, Shane Dwyer with Channel 10 WSLS. What I'd like to know, obviously, everybody's talking about testing right now. We've been hearing anecdotally from health professionals that, in their opinion, testing doesn't matter. They're going to treat it the same way, and they're going to take the same precautions, whether they test positive or not. What is Carilion's opinion on that, and is testing of utmost priority for you?
Testing is very important in the proper situation. It allows us to properly manage patients. There are illnesses that present with these symptoms for which we have great treatments, and we certainly would want to dispense those as needed. It also helps us to cohort and protect others if we make a positive diagnosis of COVID-19, and it helps us preserve our ability to care for others. So testing in the right situation is very important.
Hi, you had talked about making arrangements to increase capacity of the ICU. Could you talk a little bit about what capacity you have on an ordinary time and how populated it is with patients, and then what you're doing specifically as to how much more capacity you're building in, and whether there'll be segregation of these types of patients?
I can start, I guess. So I'm not going to be able to give you specific numbers, but the concept is that we are considering non-essential surgery, and also we will be making changes in our outpatient visits to open up capacity. We have capacity in the hospital now. As you've seen in other hotspots, that capacity fills rapidly. So both at Roanoke, CRMH, our hospital here, you guys will splice that out. But also elsewhere, we're making sure that we have the right venues and facilities to care for everyone. So as an example, if the need arises, we have capacity at Community Hospital to open up additional beds to care for people. That bed number is somewhere in the range of 60 beds. And other examples such as those exist. So we're planning and making sure that we can do our best to have the needed capacity.
All right, you guys touched that you would be opening a facility specifically for tests. What is kind of the time frame for that? And can you guys kind of talk to us a little bit more about what your plans for that would be?
We're looking at several sites right now, and we expect to have something available in the next 24 to 72 hours. And Luann, I'll just comment to you, we have in Roanoke about 150 ICU beds, and not counting NICU beds, which is a very large ICU for neonates. And we're looking at other capacity in general. But as Dr. Skolnick mentioned, by decreasing non-essential surgeries, it also opens up other capacity for us.
Could I follow that up? Because there's concern as to whether there's enough respirators and equipment. I'm sorry, I'll ask it again. And following up as far as, do you have enough equipment to, if you increase and say you've got 60 beds full in an ICU unit at community, do you have enough respirators and other equipment to treat this type of patient?
So let me look at my crystal ball and see what it says. Just kidding, but we don't have a single case right now. So we're preparing for the future, and we're working on that as we go along.
Regarding your question on the respirators, we are making provisions to acquire and to quickly get additional respirators if we were to need them.
Can you say how many tests you currently have pending and whether there's still a daily quota in place, a certain number of tests can be administered at one time?
I think the number you quoted was all the tests we have pending.
Yeah, that's the number that I had quoted to you. We have 165 tests that were run.
And are there any that you're still waiting on results for?
Yes, there are, because as you know, it can take 3 to 5 days for those to come back. I would say we have about a third of those results back.
Just following up on that quickly, what happens to those patients that are currently waiting for pending tests? Do they remain at the hospital or do they go home for self-isolation?
No, go ahead, Paul.
Both things occur. So we have patients who are hospitalized right now who are waiting for test results, and there are other patients at home who are waiting for test results.
Paul, why don't you comment, why would somebody be waiting in a hospital versus home?
Well, whether someone's hospitalized or is at home is dependent on the severity of their illness. So the preference is if people can be at home, that's where they should be so that they can self-isolate. And if they need the services here at our hospital because their illness is severe enough, they'll be admitted to the hospital.
And a second question, the rumor mill went crazy this weekend saying that patients were being discharged left and right to make room for beds. Has the patient discharge threshold lowered in face of wanting to make more room for possible cases, or is it still remaining the same?
The threshold to discharge patients and the threshold to admit patients has not changed. We will not change the way we care for our patients. If a patient needs to be admitted, we will admit them, and when they are ready for discharge, they will be discharged, not dependent upon we're going to free up this bed sooner. We have very strict discharge criteria to which we continue to adhere to.
Getting back to the testing, is your criteria for testing the same as the Department of Health, or do you have looser guidelines? That's a good question.
Yeah. So the criteria are similar, but where we're accessing testing is different. So as I said before, the baseline is that you have to have the proper symptoms, fever and respiratory illness. Otherwise, we're not going to test. The access to test kits is thankfully going to increase and has already increased through laboratories standing up that are outside the state system. So Quest, LabCorp, Roche. This is increasing our ability to get test results back. But the same criteria apply. For us as a hospital, we are especially focused on caring for patients properly and making a diagnosis. If we had fuller access for test kits from an epidemiologic standpoint, it would be good to be able to test asymptomatic people who have been contacts of known positive cases. That's the province of VDH. And that's part of the issue now with the limited number of test kits that we have. So our hospital is focused on caring for patients, and it's focused on making sure that we know and are able to diagnose an illness in a particular patient with the proper symptoms.
So I know we don't currently have a reported case in our region, and that's something that many people find comfort in, that we don't have one here yet. But for, say, for example, you get a positive result back today. I know you said you're anticipating and prepared, but what changes specifically are you all going to enact to help keep the community safe if we do get one?
Yeah, I can take that
soon.
So I think we all tried to stress that we want those things happening now. We want those things happening, and they are happening now, before there's a positive test result. Ms. Agee put on her crystal hat or crystal ball, and now I'll put mine on. We will have a positive test result in this region. It's just a matter of time. And so we're in the containment phase, the social distancing, all those things about hand washing and other things that were mentioned, they have to be happening now. Now is the time for those things to be happening, not after we get our first test result back.
I'd like to ask some of the questions that have come through the conference line. So first is, what is the criteria for testing someone, and how many test results are out there that you're waiting to hear results from? We've heard the second part of that question, but maybe you could address what's the criteria for testing?
So for us to order a test, first the patient has to have the relevant symptoms that are consistent with COVID-19. And those especially include fever and respiratory symptoms such as cough and shortness of breath. Secondarily, all of our testing will be by physician order. And so our physicians are well skilled in understanding and deciding who needs to be tested. That's why I said patients should call ahead to their physician if they're worried about where and how to access care. We also want to make sure that people who don't need testing aren't being tested, so we have enough kits to test others. So for instance, we will not be, and we don't want to be, for lack of a better term, testing the worried well. If you don't have the relevant symptoms, you don't need a test at this point in the current state where our testing capacity across the nation is limited. So those are the kinds of thoughts that go into whether we test someone or not. And as you're getting tested for COVID-19, you're going to be tested for other respiratory illnesses, because the vast majority of time currently, you will have a different diagnosis, such as influenza.
Thank you. When do you foresee getting more tests? And we've talked a little bit about this. And what's the pipeline look like?
Yeah.
We're going to keep you at the podium.
Yeah.
Dr. Stoll.
That's very hard to say. I think that the initial supply was severely limited. For instance, in Virginia, our initial allocation was 500 test kits. Now that the companies are stepping forward, those numbers will go into the thousands. And as time goes on and others come and step up to the plate, I hope that that number increases significantly. So we're still at the phase where we have to test wisely, but the access to these test results is increasing, and importantly, the turnaround time, the amount of time it takes from when we send a test to when we get the test result back is decreasing. Instead of, as Dr. Weiss mentioned, 3 to 7 days, it's going to be 1 to 3 days. So we are making progress, and we have to make additional progress as time goes on.
Okay, hold that thought, you're on the right track. With the limited number of tests that have been done, we're hearing experts say it's here, but we haven't tested enough people yet. What are your clinicians' thoughts on that?
I think that it's inevitable that we will have positive test results in this region. One need only look across the country to see how that's happening. Our goal is to try our best to limit the spread of this virus throughout the region. There is this fine line between panic and knowledge, as Ms. Agee said. Now is certainly not the time to panic. Now is the time to take wise precautions to protect yourself, your family, and your community. Those steps include limiting your contacts, self-isolation, or rather, the better term is social distancing, washing your hands, covering your coughs, coughing into your elbow. All those things matter greatly in terms of spread. Making sure that, as we do here in the hospital, that things are clean and disinfected. All these things will help to limit the spread of the virus.
We have time for one more question.
As clinicians, obviously you're not people's babysitters, but when you see pictures of people still going out last weekend to all the St. Patrick's Day celebrations, I was at Valley View Mall yesterday where a lot of the restaurants were still full. People don't necessarily seem to be taking this advice super seriously, partly because we're hearing a lot where they're like, oh, well, there's no cases in Southwest Virginia, so why do I need to care? What can you tell people about what they need to do, especially people who think this weekend is going to be weekend as normal, we're going to go out, we're going to take it, and especially what can you say to these small business owners here in the region that are grappling with this decision of, do we keep our doors open or do we put public health first? As clinicians, what do you say to them?
So to your last answer, we put public health first. I think the three of us would say in stereo, wash your hands, keep surfaces clean, practice social distancing. This is the way we can contain the virus, and that's the most important thing to do right now.
Thanks, everyone. Just a reminder that we are posting our updates on carillionclinic.org/coronavirus in real time, so please look there for further updates.